My name is Bakr Musa, and I'm the president of our Student Association, which is Nigerian Student Association.
मिश्रा मैं करीब 20 साल से नाइजीरिया में हूँ, लागोस में प्लेस्ड हूँ और अभी नाइजीरियन इंडियन रिलेशन के लिए हम लोग बहुत सारा काम कर रहे हैं गवर्नमेंट को कैसे
Ladies and gentlemen, HEAL-Thy Samvad, in collaboration with Healthcare Continuum, a platform dedicated to fostering global health collaboration through the rich tapestry of Indian expertise. It is an absolute pleasure and privilege to extend my heartfelt greetings to each and every one of you gathered here today. I am Vidya Roy, Chief Program Coordinator for HEAL Foundation. In an era where our world faces unprecedented health challenges, the importance of collaboration, innovation, and shared expertise cannot be overstated. HEAL-Thy Samvad stands as a beacon of hope, a nexus where diverse voices, ideas, and experiences converge to address the pressing health issues of our time. Now, please allow me to welcome Dr. Swadeep Srivastava, founder and chairman of HEAL Foundation, to present today's welcome address. Sir.
Thank you, Vidya. Good afternoon, everyone. And as HEAL Foundation, as you all know, we have been into healthcare advocacy through various platforms which we have been working on. Starting from just recently what we concluded, our 8th National Health Writers and Influencers Convention at home at AIMS, where a lot of our friends who are sitting here, they were also a part of it. But first of all, welcome all my dignitaries, starting from Dr. Professor R.K. Srivastava, former DGHS, Government of India, former Chairman of Medical Council of India. He has always been a welcome force for us. He's always been a very motivational force for us, for guiding us for a lot of activities in healthcare advocacy, what we have been doing for many years. And also welcoming our new guest, Dr. Zoya Ali Rizvi ma'am. She is Deputy Commissioner with Ministry of Health and Family Welfare, and I'm fortunate to get acquainted with her. She is in charge of adolescent child health and nutrition in the Republic, a very important portfolio. And our old friend, very close friend, Dr. Urvashi Prasad, everybody knows. She is a director in the office of Vice Chairman Niti Aayog. So Urvashi has also been aligned with us, and we have been meeting on various forums and various programs together. She has also been our guiding force. And welcoming all other speakers and dignitaries who will be joining us. Few of them have joined, and I think we are waiting for Dr. Rajkumar, Director of Vallabhbhai Patel Chest Issues, Mr. Vivek Segal. He said he will be getting a little late, and the Nigerian representatives. Dr. In the second session we have Dr. Ravi Gaur, Dr. Jitin Mahajan, and Dr. Tantra Dalsulta, Dr. Ishan Pandita, which is moderated by none other than our good friend Dr. Rajiv Chitra. So today, one of the things what we have been seeing is that as HEAL Foundation and our friend Mr. Ramesh, Mr. Rastogi, who represents and he runs a very I would say a very active forum in healthcare domain. That's Health Continuum. Health Continuum is a very active, very proactive group of professionals from healthcare domain, mainly the medical devices, medtech industry, the policy Mahotsav, what they do every year, the medical policy Mahotsav they do every year. So I have also been a part of that group. So what we realized that as various forums and programs what we create from time to time, we have been doing the conventions. Recently we concluded the Padma Doctors Congregation, the Bharat Swasthya Mahotsav, and a lot of other programs, Healthcare Changemakers Convention, conclave we did last year. So a lot of this series what we have been doing, we realized that there is a space, particularly in Delhi, where we should do small roundtables of the like-minded people from the healthcare domain. And these are the people whom we should fix a date, like what we are doing as an experiment, that we created a forum, HEAL-Thy Samvad, under our banner, and we said that we will do this Samvad every third Thursday of the month. Every third Thursday at high tea and at a very central location, like this Foreign Correspondence Club. And this will become a place where we can book our calendars and take up various pertinent health issues from time to time. One of the core issues what Mr. Manish Rastogi has been always advocating for is health diplomacy. So this is from where we started, that we take this core issue of health diplomacy and we'll try to imbibe very fruitful discussion on this issue, and we will have the right kind of experts and prominent speakers who can come and share their views. And of course, in all our programs, our media friends are always there, so welcome to them also, our media friends who have come today. And we can do this series and come out with some sort of recommendation consensus on a regular basis. And this forum is not owned by us, this is owned by everyone who is present here. All the people who we are connecting over a period of time, they own this forum. They can also come up with their own issues which they want to take, bring into limelight, or want a discussion around those issues. And we are happy to collaborate and bring those issues also from time to time. And it will be a multi-pronged participation. Like as you all know, we run a healthcare changemakers club, which is a representation of all segments of healthcare, starting from top doctors of the country to the policymakers of the country to the industry representatives, the CEOs, CXOs from various industries, from pharma. Today in this hall also we have representation from leaders of pharma industry, medical devices, medtech industry, and tech startup. All these people are, and of course people like Dr. Urvashi from Niti Aayog and the Ministry of Health representation will try to keep seeking from time to time. And of course the ambassadors, embassies will be connecting over a period of time. Like this time we connected with the Nigerian embassy and they were kind enough to participate in this. So this is just a beginning wherein we wanted to sort of create small discussion groups on very specific topics agenda and take it up at least once in a month. We can definitely spare 1.5 to 2 hours to put an effort in terms of creating discussion, deliberation on important healthcare issues and trying to create some sort of direction, consensus, and more important, a collaborative working in what our motto is, healthcare improvements. So with this, I would like to start this program with the first session, and thank you again for all of you for participating. We'll start with the first panel, and our host I will be India. Before that, I'll just run a small video of what we have been doing. Recently, we have done at HEAL Foundation. That will give you some idea what we are about. And of course, our work horizon is quite wider. The 8th edition, they had an excellent attendance of almost more than 45, almost 50 international journalists and 15 new social media activists. And one of the milestones what we were able to achieve on the next level of our Health Writers Convention was this addition of this breed called New Age Social Media Influencers. The participation was very intense, very useful. We had a panel of more than 35 key opinion leaders, doctors, experts who were able to come and teach knowledge. Our responsibility of training these healthcare storytellers was achieved in a very effective way. Another milestone, we have already trained more than 1,000 journalists, health writers, healthcare storytellers. Now we have reached a level where we are growing every day, training more, and that is one of the big achievement, big satisfaction. The whole occasion was celebrating the 25 years we have been in healthcare storytelling. Thank you so much.
advocacy plays a pivotal role in driving positive change, shaping policies, and championing the rights of individuals to access quality healthcare services. Today, we have the privilege of bringing together a diverse group of experts who have dedicated their lives to advancing health advocacy, both locally and globally. Our first session is on health advocacy across borders, synergizing global and local endeavors, which will be chaired by Dr. R.K. Srivastava, ex-chairman, Medical Council of India, ex-director, General of Health Service, Government of India. I have an honor to introduce our panelists for the first panel discussion. We have with us Dr. Urvashi Prasad, Director, Office of VC Niti Aayog, Dr. Zoya Ali Rizvi, Deputy Commissioner, Ministry of Health and Family Welfare, Government of India. And joining us soon, Dr. Raj Kumar, who is the Director of Vallabhbhai Patel Chest Institute and the Head, Department of Pulmonary Medicine, Head, National Center of Respiratory Allergy, Asthma and Immunology. And joining us soon will also be Mr. Vivek Segal, SVP Corporate Affairs, ABG Spence Brand Book, and Public Policy Expert for Business and Economic Growth. Welcome panelists. Now over to you, Dr. Srivastava.
Now it is better than bit audible.
Perfect.
Thank you very much. We are starting this discussion about health advocacy within country and outside country. We have got excellent panelists. Some are here, some are in pipeline, representing the policy system of Government of India, and the system, the government system, UPI, family welfare. So without waiting for any other further discussion, let us start hearing from the experts what do they have to talk about all this issue. We have heard about this word umpteen number of times. Health advocacy, health advocacy, health advocacy within country, health advocacy outside India, health advocacy international among them. So let us hear from the
Hello. Urvashi on the dais. What I think Mr. Basu was actually basically asked is how does the ministry, I think if I get you right, is that how does the ministry work with various stakeholders from various backgrounds, not just nationally as well as internationally. So I fully agree, because if we are looking at any health program, any health intervention, be it TB control, be it adolescent control, be it adolescent health, be it child health, maternal health, all of this we have to move with partners, and those partners can be government partners or non-government partners. So I think speaking very generally, I would say that it depends on who the stakeholders are. If we are referring to maybe a disease like tuberculosis, the stakeholders will vary. If we are referring to a program intervention for adolescent health, then the stakeholders will vary. But broadly speaking, the ministry works with, of course, our colleagues in the states and union territories, that is the state governments. Besides the state government, we also have the non-governmental organizations. So these can be community-based organizations or civil society organizations. Besides this, we also have our UN partners who are also supporting health programs. Then we have our academia, our research institutions, the AIMS, the ICMR. Besides this, we also have private partners who are doing the last mile. So a lot of times the government programs do reach up to the health institutions, but they don't actually reach the last mile, so that you reach the beneficiary at where he, she or they are. So for that, a lot of times the private partners come in helpful, the local NGOs come in helpful. So broadly, I would say that for any health interventions, we have to move together, whether locally or globally or internationally. Everybody has to be in it together, because the beneficiary can be you, I, our children, our nieces, nephews, our elderly, our parents, our uncles, aunties, anybody. So since health is for all of us have to work together for health. So let me just stop here and see what she has to say. This is looking well. Thank you to the chair and also to the organizers for having me here. I think to begin with, I would just say that when we talk of health advocacy, it is very broadly speaking, that I see at two levels. One is, of course, within the country itself, where we are advocating for policy change, we are advocating for patient centricity with the private sector. So advocacy is not just with the government, and even when we say government, I think it's very crucial to recognize it's not just the central government, but very importantly in India, the state governments, because a lot of action in India in health happens at the state level. And actually states can move much faster in many ways than sometimes even the center can, for obvious reasons. It's easier to move things forward at times in the state than at the entire national level. So even with government, the advocacy, I would say, has to be at multiple levels. But it's also equally with the private sector, with the pharma companies, for instance. When they are coming up with their new drugs, their new diagnostics, it's very important that patients, are a very important part of that whole process. And I say this, being a patient myself and somebody who's living with cancer. And so I can say that, if you don't have the patient voice, you will never come up with the right kinds of, drugs, the right kinds of diagnostics, with the right kind of side effect profile. So the patient advocacy part is also very, very important. So I think that's at a domestic level, and as Zoya said, that there's multiple actors, involved in that advocacy. The other is, of course, the cross-border or the global diplomacy, and a lot of it we try to also highlight in our G20 presidency that just concluded, but it has to be an ongoing thing. It cannot just be a 1 year or a one-off exercise. Because now we can no longer afford to look at diseases as, this is only the disease of a poor country. Tuberculosis being a classic example. Tuberculosis has always been called a poor man's disease. It's always been considered only a developing country problem. But now you're finding that, since if we look at the statistics, then
we have now Mr. Vivek Segal with us. He is SVP Corporate Affairs, ABG Stern's Crown Group, and Public Policy Expert for Business and Economic Growth. Welcome, sir.
Thank you, and sorry for being late. And as I had informed, I had some meeting which came in early on the day. Thank you so much.
So I'll just continue and I'll conclude shortly. So the second part is like I said, the cross-border, the global diplomacy, which is, as I said, now no longer a nice to have, but it's something absolutely essential. And that is because we can no longer think of any disease as only a problem of one part of the world. If you look at tuberculosis, since 2020, every year the United States has seen an increase in tuberculosis cases. So, and a lot of these are in fact what we call MDR TB, also multi-drug resistant TB. Newer strains of TB are emerging all over the world. It's not just India or Africa or poor countries as we've always thought of it historically, or a lot of the rich countries have thought of it rather historically. So I think that is changing in a very interconnected world, as was said at the beginning of the session. And the second part is that we simply cannot make progress, whether it is in vaccines, whether it is in new drugs and new diagnostics, if we don't share technologies, we don't share knowledge across borders. So that is something that is absolutely essential, and of course we have to continually advocate for that. More so, I think, with the richer countries. I think what we call as the global north. We really need to push them to take up their responsibilities in a stronger manner towards the global south in every which way, in terms of funding for these issues, in terms of sharing knowledge, in terms of sharing technology, etc. So I think the pandemic has hopefully been a wake-up call for at least some people, but we're always in danger of forgetting things and going back to business as usual. So I think we have to ensure that doesn't happen, and we keep up the momentum of some of these conversations, both locally, nationally, as well as globally. Thank you.
Thank you very much. These are two largely medical conversation on health. Doctors are usually complicated and complex. So to make the simple, both of you permit, and wherever I am wrong, I am not interpreting you right, please. In simpler terms, health is our right, and we have to know about our health. What are the various components of individual health, like nourishment, like not practicing bad habit. Now these should be known to us. If there are potentials for certain type of cross-border transmission of infections, they should be priorly informed to us. And for doing all these things, because we are living in a global village, there are mechanisms which are operating within the country, there are mechanisms which are operating within the globe, which whether you like it or you don't like it, has been divided into high income group and we belong to the data. So what we have tried to convey to you in the simpler terms, that advocacy through all the mechanisms which have been narrated for specific problems like tuberculosis, for COVID or the current situations, the advocacy is a fine-tuning mechanism of converging all these actions so that patient can be empowered, so that he can look after his health as well as possible. Where he is not capable on account of constraints, which may be physical, financial or other type of barriers, he should be supported by the system. System can be operated by the government, can be operated by the non-government operator. There should be a mix of two, and because health is a complex thing, the pharma industry, industrial benefits are there. In healthcare industries, doctors have got their benefits. There are large number of hospitals which have got their own. So all should converge so that they do good for the patient and they survive. Probably you have tried to convey. I have just tried to simplify it. If I am anyway wrong, please.
Yeah. Can I just comment? I agree with what you say, but I think for government as such, a lot of it is not just patient, a lot of it is also preventive and promotive now. See, patient is done, and I think especially for the child health and adolescent health program, a lot of our interventions deal with how do you prevent onset of diseases, how do you promote healthy lifestyle so that you end up not having diseases. So Dr. Srivastava is right, a lot of medicalization of health program has happened, but a lot of prevention and promotion activities are also underway, a lot of health programs so that we have a healthier population as a whole which is not affected by disease also.
I 100% agree with that. He's very rightly said. I have used the word patient. It is not patient, it is people. Health is people's issue. Everybody's issue. So prevention and promotion, the cheaper, the better, the easier it has been practiced since ancient times. You have to see it like that. But whether you like it or not like it, our 70% investment goes for it. So thank you. I have just tried to simplify it. And thank you very much, ma'am.
thank you very much in the first place for having me here. In fact, I realized that I'm the only non-doctorate on the dais, so permit me to make mistakes. So thank you for, of course, also waiting for me. I'm sorry, apologies, because I had a meeting which I had told the team here is likely to either get extended or delayed. Definitely glad to be here on this forum for the simple reason that TV actually is something which has been a focus area of the government for many, many years. And there have been some tremendous efforts which have gone into the system, both from the side of the government as well as the private players, whether it's the pharma companies or the hospitals or the NGOs. Yet, though we may have covered a lot of ground, but there's a lot more for us to actually look forward to. And I think the long journey has brought us even in a situation where probably other countries could learn from us. So in terms of access, before I make any mistakes on the figures, so far as the supply of medicines is concerned, as per the WHO PV report, it actually increased from 81% in 2015 to 95% in 2020. And I'm sure it must have only gone up over the years. So I think that's kind of a remarkable achievement when it comes to being able to provide access to medicines. However, there have been other factors which have been responsible in terms of achieving this access, which is of course the use of technology, which has ensured that the right forecasts are made for the requirement of medicines. They are amply stocked. They are very well distributed on the supply side of it. The other piece which is I think also been happening is in terms of scanning the patients and having the interventions at the right time, the right stage, which is crucial to not only the patient himself but also the caregivers at the end of the day. So I think all these factors have really brought in the kind of change which we are seeing today. But at the same time, we can't rest on our laurels and say, okay, we've done enough, because the disease still exists and we have the SDG goal of eradicating it by 2030 with, of course, the Prime Minister's vision of being able to eliminate it by 2025. So 2025, as we sit in 2024, is just a few months away. So I think we really need to look at what has been holding us back in terms of not being able to achieve what we should have achieved, and how will we actually eventually make the vision of the Prime Minister come true and not let his commitment not be met when it comes to eliminating TB by 2025. Now there are a couple of things which I'd like to just bring up to the forum. One is, I think there is a greater need for building partnerships. And these partnerships have to be built in by the stakeholders, as I think Dr. Srivastava was also mentioning, that needs to be enabled amongst various stakeholders. And these partnerships will increase our outreach, because I think one of the grey areas has been to reach out to non-mini metros or non-metro cities. And that is what is actually driving our average down. That is what is causing the challenges for controlling TB. It's not to say that you can't find TB in metros or mini metros, but the incidence of the cases are far too less. And if we can actually bring the semi-urban or rural areas under our control, things would definitely be looking better. So that's where the role of partnerships is very, very important. And the government has to definitely take a lead. The state governments have to work in very close coordination on one hand with the central government, pushing their efforts through, as well as building local level partnerships, whether it is pharmaceutical companies, whether it is NGOs, whether it is local hospitals, to make sure that we are able to scan the cases in time, we are able to treat them well in time, and also control its spread. The other piece is within the partnership I'd like to put in is creating a lot more awareness. Today the awareness of a patient or even the family members that a family member is actually having TB is far too low, and they actually reach the hospital only when things are at an advanced stage. So I think a lot more on awareness is required to be done, wherein the initial symptoms of TB should be well communicated to the masses to ensure that they reach their physicians or doctors or nearest health centers and hospitals quickly. One more thing which I'd like to stress upon is again from an industry perspective, is the quality of the medicines and the quality of generics which are available in the market. That is a very, very important issue when it comes to the efficacy in making sure that the patients go back healthy to their homes. So I think a little more regulation on that aspect, though I may be representing the industry, but as I think Bakr said, I like to do a bit of advocacy, so it's a more balanced view which I'm going, and generally the industry doesn't want to ask for regulations, but in certain cases it's good to have more regulations when it comes to lives of the people, because we're not dealing with a business alone out here, it's actually we're dealing with human lives. So that's the second broad thing which I'd like to point out where we need to do a lot more. The third piece is capacity building, and I think we talked about sharing of knowledge, etc., which of course is very, very important. I have been on the other side of the table in my previous assignment when I was working for an association which was predominantly a multinational run association of pharmaceuticals. Let me share with you that a lot of people are very willing, even out there, to share their information and share their knowledge. Of course, it's a hard-earned knowledge. Billions of dollars go into research and development, but they're willing to share. And I think we need to just create a right ecosystem within the country for them to be able to share that information, share that knowledge without any fears, without any fear of losing their proprietary on the knowledge. So if we can build that into the ecosystem, I'm sure they would be willing to share there, and we can create a platform for them to come forward and help us in sorting out these issues. Apart from the research and drug development, I think I'd like to touch upon the capacity building of handling cases, or being able to manage patients. I think that's where we need to build in a lot of capacities within the health ecosystem to ensure that we are able to overcome these issues. Because whether it is training of doctors or caregivers, back at, again, I would talk about the semi-urban and rural areas, is equally important before we actually look at very seriously in being able to achieve our target of eliminating TB by 2025. So that's all from my side, Dr. Srivastava.
Because we have got limited time, we have to finish things within that time. So what about the last gentleman who was Dr. Rajkumar? So do we have some more time?
Yes, 7 minutes.
Okay, so we say you have heard industry view, the political view, the professional view, and I have tried to simplify it, and I will try to simplify his view also. Industry is interested in building solutions which can meet most of the public health problems, and they have to put a lot of money in research and development. They want to partner with the government so that they do the targeted research. They want to provide it in volumes of high quality at a rate which is affordable, and that also needs some type of partnership with the government. And they also want to partner with the providers so that at the end the patient takes them and get on that. It is industry question. Health is not at present health is not something like service where any of the stakeholder will not operate without thinking about return on investment. Be it government, be it industry, be it policymaker, and be it the end user. So this is overall creating a very complex thing. You have heard them, you have heard him also. These were all budding persons. Some of you are journalists, some of you are doctors, some of you are already involved in the advocacy. Good number of you I have seen in good number of platforms. Please feel free to ask questions if you want anyone. Please.
May I now request Mr. Manish Rastogi to present the memento to Dr. Zoya. May I request Mr. Atul Sharma to present the memento to Dr. Olushi.
Thank you very much.
Very difficult questions for me. I know.
Should not ask easy questions.
Of course, absolutely.
Thank you.
Thank you.
May I now request Dr. Rajiv Chibber to present the memento to Mr. Vivek Seegal. Cultural diversity and rich tradition of healthcare practices occupies a unique position in the global health landscape. Today, we celebrate the wealth of knowledge, talent, and innovation that India brings to the table. As we seek to harness this collective wisdom to drive positive change on a global scale, we embark on this journey together. Now let us move to our next session on health diplomacy, global healthcare collaborative outreach, and partnership with invited global south country Nigeria. We have a few friends from Nigerian Embassy. We have Director of Nigerian Association of Students and Mr. Devesh Kumar Mishra. He is the Managing Partner of HEAL-Thy Samvad, Africa. Chairing this session would be Dr. Rajiv Chibber, Vice President External Affairs, Sanchana Medical Technologies Limited, Joint Coordinator Government and Public Affairs, AIMD, Member FICCI and CII. May I request Mr. Divesh Kumar Mishra to come on the panel, please. We also have with us Dr. Ravi Gaur, founder and director of Path Labs, Unideology Specialty Laboratory, group member of FICCI Healthcare, CII Chair Health and Wellness South, Associate and member of MedTech and Diagnostics group member. We also have Mr. Jatin Mahajan, Managing Director of J. Strand Company Private Limited, Secretary of ADMI, Association of Diagnostics Manufacturers of India, Coordinator of AIMED, Association of Indian Medical Devices Industry, President of IDD, GNAV, Global MedTech Advocacy and Advisory Forum. We have with us Mr. Atansh Das Gupta, Senior Director, Southwest Asia Head, Samsung HME, Co-Chair of Medical Devices Committee, PHDCCI. We also have with us Mr. Ishan Pandita, Additional Director, FICCI. Thank you, delegates. I hand over the session to you, Dr. Rajeev Chaturvedi.
Thank you very much. I think the last session
we have Mr. Abu Bakr. He is the President of Nigerian Associations of Students.
Okay, thank you very much. Good afternoon, and it's almost evening now. Good evening, everyone. So the last session kind of like ended on a slightly good note where we were able to see how a national mission could actually unfurl and be expanded into global diplomacy also, and rightly as the chair of the last session said, the global diplomacy will now unfurl when India reaches a level where 2030 will be recognized. So yeah, this session actually talks about how the South-South cooperation will be really important for a globe where it was earlier, the regime was normally the North-South. But now it's changed to a level where diplomacy has worked its way through, and we've been able to also pave into a lot of areas which have actually turned India into a global leader. Not only India, but I think all the South BRICS countries, and even in G20 when we had a few more addition in the Africas and Americas also. With this, I think it's become more pertinent that when we talk about global pandemics, when we talk about areas of concern in terms of prevention, when we talk about diagnostics, when we talk about healthcare to all, even how globally the South countries have this new word coined in terms of universal health coverage, which will be for one health, is something that the world will watch very, very closely. I myself have been into certain areas of South-South cooperation, into global diplomacy, into Quad, into the BRICS alliance, and recently we've had enough debates around it. The government was gung-ho about taking forward a couple of new initiatives. And health is something which is now converted into One Health. So One Health, Vasudev Kutukam, that our Prime Minister talks about, and is also something that engulfs everyone, is something that we all envisage for. So with me, I have a very distinguished panel, and everyone is a leader, not only in the healthcare sphere itself. But I think, if I could really term it, it's called healthcare diplomacy to a globalized world. So we would be looking at, areas where not only there'll be more collaboration between the South, especially, we've got colleagues from Nigeria, we've got colleagues from Africa. Both Asia and Africa have become a great collaboration in terms of not only technology but in terms of also collaboration between human minds. We've been able to carve out the diplomacy from a very niche area, which initially started only with localization to now a globalized world. So let me kind of like come to the first panel member, Dr. Kaur. You've seen how India looked at the entire diagnostics unfold over the past couple of years. Even when we started Ayushman Bharat, and then we gave a clarion call for universal health coverage, and then moved from universal health coverage to One Health, especially when G20 expanded, India expanded its role into G20. Still, there are areas where collaborations have really not met expectations. We've looked at how both India and Africa, and even if you go down to Latin area, etc., there are common disease ailments, there are common issues on prevention, there are common issues on diagnostics. How would you kind of like look at this convergence being unfurled in the next couple of years as we move towards not only 2030 but 2047, and countries in the south also move towards a really convergence arena itself?
Good evening, everyone. And thank you, Rajiv, for being here. I think it's a pleasure to talk to all of you regarding diagnostic, which is very close to my heart.
This one.
Okay, very close to my heart. Like sometimes it pains when I see that, like in countries in the developed world, in some part where you probably just walk through and the disease is diagnosed. And in some countries, in some places, you have to walk miles to a diagnostic center. I think that's the biggest disparity today. What we not only see in India, probably we're seeing in the entire world. When it comes to COVID, the first thing what COVID did was, I think the answer to all this is just collaboration. All of us, whether it's a diagnostic service provider, or it's a manufacturer, or devices reagent people, policymakers, research people, IT, technology, not only India but global, everyone came together. And that's the reason I think within 2 years, such a big pandemic, which was, I think, millions of lives, we were able to get through. And I think that's something we have built up, we have learned, which probably we would have done 15 years from now, we did that. And this is the first, I think, I also feel that in the pursuit of health, let's not time or a place impede our cause for every soul deserves some kind of a gift of life, which is through the lens of truth, care, and diagnostics. I think that's a fundamental thing we need to work on. If you have this principle, you should be able to work properly providing things. Now, in India, I think we have again some programs for prevention. I think the challenge what is happening in India is when it comes to diagnostic, even healthcare. Because if you go to, I did my internship probably long back in 1985 in the remote villages of Madhya Pradesh. There was hardly any diagnostic primary health centers were there, nothing was there. But then what happened after there still villages had some population. Now with the infrastructure, with the growth, villages have started moving towards bigger cities. A lot of migration has happened. But when they come to places like Delhi, Bangalore, Hyderabad, Pune, Mumbai, they can't. They may be staying next to Vedanta, next to Gangara, but can they afford the healthcare? Accessibility is not there. Because that is created in the area of something called urban slums, condensed population. So again, primary healthcare centers set up in some remote villages. Problem population is about here. We need to relook into the entire system of providing the service, and this is another problem because the infrastructure, bigger cities, I think they have best global facilities in India. But are they able to look after the population? Look at the example in Delhi. We have so much urban slums in the neighborhood. But Delhi alone, if you look at it, it's been created a structure which if you move this urban slums and people will be able to world-class facility. But we are not doing it. And that's another area. Now I'll come back to just small questions. That's something you talked about, Nigerian part. I think I'd like to have something on South Africa. So I'd like to give small data about India and Nigeria when it comes to together. So because if you look at the population, right, diagnostics and data I have got something. The US has got a population of say 332 billion. India is about 1410 million. Then Nigeria has about 220 billion. Now when it comes to the number of labs, it is the number of pathology labs in that population. India, we just have almost like total, US has got almost like 2 lakh labs. So for 33 crore people, 2 lakh labs. India, 1,400, 140 crore, we have again 2 lakh labs. But when it comes to Nigeria, probably in countries like that, we have 22 crore people, 2,000 labs. So the ratios are fine. That is where we need to be working on. Same thing happens for the pathologists. A place like in US, there are almost 22,000 active pathologists. A place like India, huge population, number of labs, we have good 20,000 pathologists only activated are maybe about 80%, not more than that. But in a place like Nigeria, 22 crore population, how many pathologists you get? So not more than 180 pathologists. Now how do you fill the gap? I think this is where probably I feel we can, as a partner, work around and take care. Diseases are common. Malaria is the commonest thing. Infections are the commonest thing. Forget about genomics as well. I think we need to work a lot on that. Probably India has a similar pattern what the countries are. Bigger cities have best of molecular genomic facilities. Tier 2 and Tier 3 move out with hardly any problem. I think we need to work on that. That's what I feel that we have common similarity. Look at the Indian pattern and what we have done together. Probably we can easily do that in various countries, and I think that's where probably a diplomacy or global advocacy will help.
That's, I think you summarized everything when you talked about it, and 2 things that I really would like to highlight. One thing you talked about is very, very close to my heart, and I think probably every government's heart is truth, care and diagnostics. Unless we have that motto, I don't think there will be a convergence, even if there is diplomacy, even if there is One Health, but if you don't have that, I really doubt that we'll be able to take forward. The other thing that you really well mixed was the infrastructure and the professionals that we really need to move up in both the countries. Or in that sense, even in the South, if you look at it, most of the countries are falling into that area where we do need more infrastructure. There's a huge population. If you look at the South population globally, it's like almost more than 70% of the world in that sense. So whether it's pathologists, whether it's healthcare professionals, whether it's HCPs, or even your infrastructure and labs that are available, everything needs capacity building in that sense. And the last part I think you talked about is accessibility. Yes, I think when we talk about it, the globe also needs to talk about the AAA's affordability, accessibility and availability. If they're not there, I don't think treatment could reach even a global part. So let me go on to the next. Yeah.
What is the only thing is one thing which is good at India is it's the last 2 years the technology adoption. Very fast innovation, disruptive technologies that come up very, very fast, and we are adopting it very, very fast. So whatever I said, something is like we need to be probably what was there, what will be there in 20 years from now. I think we'll achieve 5 years from now. That's a learning probably, and we all can probably do that together.
Thank you. You made my job more easier. That was my next question, and I would have moved on to Atantra for that in terms of how we look at technology. I mean, Atantra. It is crucial to strengthen technology advancements in healthcare, especially when we talk about the global south. The kind of transfers of technology technologies that are required, the kind of technology advancements that really need to cater to that kind of a population that we're looking at. There's an immediate low-hanging fruit that we can look at is in terms of plugging the gap through technology. How do you visualize this when we come to technology in the global diplomacy arena, and especially when it comes to maybe the South-South diplomacy that we're looking at, and India-Africa or India-Nigeria?
Thank you, Dr. Chubar, for asking a very well thought out question. How technology makes a difference. So if it goes back to 1970, when Falconian went for a diagnosis in the X-ray clinic, he saw the diagnosis was done with a non-human actor, that is the X-ray. At that time and after that, lot of innovations have come place, and we saw still the technology, the non-human actor is a subset, and a human actor was a super subset of this entire system. But now with the digital health, the things have changed. The digital health occupies a very important position, and it is there into every subset of a health system. It is not in isolation. I was just looking at my watch and I was thinking that how much activity I have done, what is my stress level, what is the heartbeat. So when we are talking about the ratio of the doctors, about the pathology, about the nurses, we must think one major difference which have occurred post-COVID or just pre-COVID, that is the infusion of the introduction of technology into the human lives and also in the healthcare. So today when we talk about disease management, let us talk about patient management and how technology is helping in doing so. So today, why we are talking about the dearth of doctors, dearth of nurses, dearth of healthcare providers, because there is an asynchronous ratio which still exists, not only in our country, but also all over the world. If you look at US, yes, it is there. So how could we bridge the gap? Because we are not going to produce doctors overnight, and it is not possible to build up thousands of medical colleges. And it's not only doctors, but other healthcare providers also play a very important role in the patient life. So I think if we are responsible and religious in doing our own bit, that is the primary of the preventive healthcare, and that can be done today because it is not a distant thing to do, because we have got tools in our hand. Every one of us in this room have a mobile, but how much time we spend in monitoring our healthcare? The health apps are there, the big companies are providing all sorts of facilities, but we are not very much interested to do so. We spend a lot of time in the news articles or in the entertainment. So if we can take out some amount of time and we start monitoring our vital signs, I think it will be helpful for us, because before getting into a serious problem, we can approach a healthcare provider to take action on it. So even if you look at Indian scenario, because there are a lot of discussions are happening in the earlier panel, still till today, only 5 to 6% of our total health expenditure is spent on primary health care. 56 to 57 in secondary and tertiary. And that is the reason we suffered during the pandemic, the big longest lockdown, because we couldn't build up the infrastructure. Another thing which we are losing, that is we are not able to harness our active population, the working population. So we have to improve the preventive healthcare, and it is not only for our country, it is also for African countries, the third world countries, where this preventive and primary healthcare is not taken very seriously. Every one of us go for a preventive maintenance of our car in a year, but we are for ourselves, our body, which is a huge engine, because it pumps blood every day and keeps us walking. So please be religious and look at the gadgets which can help us to take care of ourselves. Thank you.
Thanks, Atantra. I think you you touched upon something very personal, that even technology can make you look into preventive healthcare, and I think it's a very pertinent point also. Especially one thing that you mentioned was pretty good, that struck me, is a synchronous technology ratio that we all are following, whether it is within the country or whether it is outside. I think tech synchronization is something that every country needs to look into, every population needs to look into, and personally someone also needs to look into very, very keenly.
Because I just like to touch upon a small point, because now the socio-materialism theory is going to have a new meaning, because technology is going to be a part and parcel of not only a patient's life but also the healthcare provider's life. It will work in both the directions. Thank you.
That's a great analogy. In fact, this is something which is going to really reap a lot of population when it comes into fructification. So we have two distinguished guests with us, Mr. Abu Bakr here also, and I believe that you are a student activist in Nigeria, and you've been able to really talk about health from a global platform. And we also have Dr. Devesh Kumar. Mr. Devesh Kumar Mishra. He is the Group Managing Director for Doniers Global, and he's a very proud Pravasi Bharati, and also looks into HEAL-Thy Samvad in Nigeria and also in the African nation itself. So let me first come to Diveshji. See, we have this entire spiel that has been now narrated. Yeah. We have this entire spiel now that has been narrated, and presumably India and Africa, especially through BRICS, especially through the global South-South collaboration, has been working a lot. Nigeria is considered as one of those big countries there in Africa, which has got good roots here in India also, and we've been able to reap a good diplomatic relation otherwise. How do you see India as one of those larger tech providers, or one of those larger, One Health goal providers, in terms of a lot of synchronization, as Tantra was saying, happening in both ways, in both angles?
Thank you. Actually, if you see Indian and Nigerian relation, it goes back to 125 years. That is the historical figure available. We don't know before that what happened. So somebody from Mumbai traveled to Nigeria 125 years ago, roughly 127. So if you see 100 plus years of relationship plus cultures, similarity both. We believe in family, they believe in family too. Like if you see, I'm there from almost last 20 years. And we have a population of 50,000 plus Indians there, 50,000 plus NRIs. Why I wanted to put some of these figures before health, so that we will, all of us in this room, will be able to appreciate and understand how deeply India has engrossed with Nigeria. We are so similar, we are so same, that if somebody tells me Nigeria is not developed or developing, I tell them it's a pilot model of India. Okay, so don't worry, the time will come. And that's why when people talk about political instability, corruption, funding, non-availability of budget for health sector, health is mostly treated there as an adopted child. So I told them, no, don't worry, this is just a time. This is just a time. And to tell you all, my dear friends, doctors especially sitting in this room, Nigeria provides you a huge lot of benefits to serve and opportunities. For investors, it is always a very big market, a market of 400 billion GDP, roughly. And a lot of role is played by dollar and all those things. So that's the challenge. Yes, challenges will always be there. But if you see from Nigerian healthcare perspective, what it needs is, especially If you see what they need from India is our experience, expertise first. Earlier they used to go to Europe for their treatment, but now because of the currency, the devaluation of the currency, they are looking towards India. And the number of patients has increased. In fact, many hospitals are now trying to set up partnership with them, for medical tourism. But medical tourism is just not the solution for a populous country like Nigeria, as you rightly said, doctor. It's 230 million people, my dear friends. It is the most populous nation of Africa. And if you see Nigeria just alone as a country, I think we always do injustice with the nation itself. Because Nigeria sits in the heart of West Africa, which is almost like a conglomeration of 15 to 16 countries, that they are dependent on Nigeria. So you always have a platform. If you have an office in Nigeria, you can go to nearby places, you can solve them, and then the population service will be like it will be almost 400 million. So we are talking about 1/3 of India almost. So Nigeria gives you a lot of opportunity, and to tell you, like the way they respect, Tata as a brand is respected more than any brand in Nigeria. They tell you, yeah, India is a brand, So old Tata Motors, 1960 vehicles are still operating. So that's why if you talk about doctors from Nigeria, you are taken with a very high gratitude and respect. Because some 30-35 years ago, most of their teachers were from India. So many people, if you meet in the bureaucracy and in the government, like some of the presidents were trained in India. So you can believe the relations there. So what I always believe and advocate for, that India has a lot of role to play as an investor, as a hospital, as a service provider, as doctors. We have a lot to do for them. Thank you.
Absolutely, thank you very much. I think you gave a very good summarization of how India and Nigeria can really work together, and something what Dr. Gaur was alluding earlier when he talked about how more preventive and diagnostic cares can actually be one of those areas, and medical tourism is one option, but then I think having more professionalism there would be another thing that we would look at. Let me move to Mr. Abu Bakr. You heard what Mr. Mishra said, and one thing is apparently clear is the infrastructure and professionalism in terms of healthcare professionals, in terms of maybe diagnostic centers, maybe more HCPs be available, and the kind of youth that possibly Nigeria can actually tap upon in terms of taking healthcare forward. Your views on that?
Good evening, everyone. When we speak about Nigeria, we speak about the most populous country in Africa. You speak about the most powerful country in West Africa. You speak about a country that has a gross GDP of around 400 billion in West Africa. And you speak about a country that is developing rapidly. Nigeria is part of the global south countries, but earlier on Nigeria looks to be global, not in terms of its own development. But like as Mrs. Beji has said, now Nigeria is looking towards the global south because of the similarities of events that unfolds between the both countries. Something like India, countries like India, Bangladesh and all, Nigeria looks up to them. Because I will call India as our neighbors, or I will say they are our mates during development. But India has skyrocketed in terms of healthcare, have moved on than where Nigeria is. Why? It's because of lack of expertise. It's because of brain drainage that Nigeria is facing, and it's because of lack of investment by the government in the infrastructure, in education, and in terms of bringing the rural community to accept the fact that conventional medicine or conventional treatment is the most unique. When you divide the healthcare system into the primary, secondary, and tertiary, you will see that in Africa, the primary is one of the most neglected sector in terms of healthcare. And that is where the preventive medicine starts. Because if you want to tackle any healthcare, you think about the prevention first than the cure. How can I prevent it? Not how I can cure it. So it's really neglected. So in terms of youth like me, activism is already part of us. We've grown into it both here in India. I'm part of India. I'll call myself as part of India because India made me. I came to India since I was a young boy. I grew through the years, and this is who I am now. I know the kind of people I'm leading now. As the Nigerian student president now in India, I have more than 4,000 students studying now in India. This is a really large number of students we are having. When you look at this large number of students, you will understand that Nigerians are now turning to India because India is a country that is developing. India, I don't see India as developing myself. I see India as a developed country. But they always look at it, Indians always say we are developing. But we that have been to India, have stayed in India for a long period of time, we say India is already developed. So that large number of students that are coming into India to study are going back to Nigeria to give that expertise that they learn in India. And recently, most recently, our government has even ventured into that. There are a lot of collaborations with universities to bring students on scholarship, to also facilitate those universities to establish their campus in Nigeria, and also hospitals here are moving down to Nigeria to develop, because now Nigerian government has opened a window to everyone that, okay, we are ready for business. We are ready for development. Before we were like, okay, we are the richest country in Africa, people will come to us. Now we are like, yeah, we have the money, but come to us, this is what we'll offer you. So people are now trooping into Nigeria. Let me tell you something, just as Mr. Dwesh has said, aside the federal government of Nigeria, India is the highest, Indians and India is the highest employer of labor in Nigeria, which is a quite good number. So, our government are now working with the rest of Indian government. There are multilateral collaborations and also bilateral collaboration that has taken place during the G20, sometime around our ministers were in India, and a few months back, even in India, the foreign minister of India, external minister, was also in Nigeria, and health was one of the key factors where he went to Nigeria to discuss it. So, Nigeria now is really developing in terms of healthcare, and we are open for development, we are open for any business, and whosoever thinks that his or her investment is threatened by Nigerian economy or something like that, Nigeria is the most stable economy in Africa. There is no country in Africa where you invest 1 rupee and you'll be sure of taking out your 1 rupee next day like Nigeria. So I will just leave you with this so that I don't feel you. Thank you very much.
Thank you very much. Thank you. I think you gave a great perspective, and you showed both sides of the coin. In fact, earlier you mentioned about how there's brain drain, and you mentioned about inequitable, access to a lot of things, whether it is education, health, and all. And the end, you end up with the rupee analogy. So that's great. I mean, Jatin, let me come to you. Obviously, you heard our colleagues from Nigeria. You, in any case, have a great idea around how healthcare is now evolving in the country. You've been, almost very active in terms of all discussions that the government has also been, privy to. So, your views on how, and even Dr. God talked about how, diagnostics and innovation is going to really take forward when we talk about the global South-South convergence. So, your, views on the spur of diagnostic innovation and how can, healthcare be on the agenda, especially when we talk about, and everyone, in fact, even in the earlier panel and this panel, everyone harped upon the fact that preventive healthcare is more important and we need to really take forward that entire notion. So, how to make testing an integral part, sustainable, resilient health systems can actually be taken forward through convergence, through technologies and through collaborations.
Thank you, Rajiv, for this question, and especially the timing and spacing of this question, because I have got this good opportunity because my colleagues here on this panel, they're giving too much of insights on the market size, market potential that the Nigerian country has. In fact, if I look at Africa, I think it is the next big opportunity, land of opportunity. I mean, huge potential. Lot of, I think not only the petrol that we are referring to here, and there would be other rare minerals also which are yet to be tapped into, and which is going to be the next game changer. So we will definitely see a lot of activities and happenings in that part of the continent as well. Now, having said that, if I talk about diagnostics, so diagnostics basically is to diagnose, and we can use any kind of a sample, whether it's a blood, serum, or a stool, or any kind of a body fluid. So what Dr. Ravi Gaur has already talked about, I will just add a little bit more over there. That in COVID, what we have realized, the context here is COVID only because in COVID, it has opened our eyes. I mean, all the stakeholders have actually opened and seen the value what diagnostics brings onto the table. So it is the first line of defense against any onset of disease. And even if we see, if we talk about health, my panel members here talked about health. My earlier panel members, they stressed on health. So the word health contains heal. And if you have to heal an individual, the first step is to diagnose as to what is the problem, what is the disease. And diagnostic is a very good tool to understand what is the problem an individual has. It is a lot of science as well as technology. So it is blending of science and technology here that we are able to predict what may be the possible reason of a kind of a deterioration in the health performance. Now, having said that, if you look at the other aspect, not only health, but if you look at science. So in pandemic, we have looked at the supply chain systems. Now we have looked at the raw material, the critical raw material which goes into manufacturing of the diagnostic, and even in the high-end machines, we look at the supply chain. So that is something that the governments have also understood, the manufacturers, all the relevant stakeholders have realized the significance and the relevance of that. Now let me also touch upon why diagnostics. So we talk about economy, like in this context of Nigeria, I'm very grateful to my Nigerian distinguished members here because 400 billion GDP is not a small amount, and it's billion. So if you look at this context, it's talking about the resilience of the economy, and health is one such area where if you have to build up a strong economy, health needs to be valued and respected. So diagnostics can play a very significant and a pivotal role here. Why I tell you? Because as I mentioned earlier, that it is the first line of screening. So when we are screening masses, then we can even identify what are the diseases which are coming in, and then before the migration where the patient goes to second, third, fourth stage, when the disease itself is caught in the first stage itself, the line of treatment can be given, which is going to be very cost effective, very economical to the patient, and also it is going to be less cumbersome for the healthcare system as a whole. Otherwise, when the patient goes into second stage, third stage or fourth stage, the complications arise in terms of the complexity of the treatment, and it becomes a big burden on the healthcare system as well. So diagnostics is a means and a method wherein we can kind of give tiny treatment to the patient. When we look at masses, so like during pandemic, I'll give reference because everybody talks about pandemic, and that's been the learning ground for all of us. Now, when we're doing mass screening, now in Nigeria, if we're doing mass screening, it throws up a lot of data. Now, individually, if we do manual intervention of data and start, analyzing, crunching this data, not possible. So, when we look at technology, so whether it is AI or MI, it can crunch this voluminous data and can throw up meaningful insights to the doctor or to the policymaker or to the stakeholder which can use this data. So this is very important that we need this hard technology. Technology I consider it as a hard skill. So this embedding of hard skill is very important. Soft skill is basically the doctor side, which is once the data is received, the doctor will gently handle the patient so that the patient is also, so handling the patient is very important. So how you handle the patient, even if it is a very critical disease, like in Nigeria we have non-communicable disease like cardiac, diabetes, we have infectious disease like HIV. The patient at that point, like the earlier panel talked about TB, they have to be handled with utmost care. Even here or there, with birds also, they may go sideways, they will not take the treatment because of the reason which has already been shared. So they have to be handled with care. So that is where the doctor comes in. So I always say that it is a blend of science and technology and the use of the right technology, which is AI and MI. And now, what Rajiv had also spoken about, the 3 A's: availability, accessibility, and affordability. So these technologies, now they are available and they are affordable also. And if they deploy, then they can act as huge data sets. Unfortunately, in India, we don't have data sets for many of the diseases. The government is now realizing, and now they have started working on this data set. But if we use the same analogy in Africa, in specific areas, what I would suggest is we also should identify. So for example, in Nigeria, we can identify, what are the priority diseases they have. And depending upon the list of priority diseases, then the technology and diagnostic tools can be deployed so that mass screening can be done. And they have those data sets, so that's specific. When we look at pharma, it is a salt and a specific salt. So that, the treatment can be very effective. So these things are of utmost importance. Second, so the other suggestions which I have with respect to the market, so between the two countries, if we can have very good collaboration in terms of the skill building capacity, because if you look at the stakeholder chain also, so whether it's a nurse, technician, the medical technologist or technician who actually performs the test, a lot of skill building, skill capacity needs to be done at each and every level, whether it's a medical technologist, whether it's a nurse, whether it's a doctor, whether it's a specialized doctor. So all those things require capacity building, infrastructure building. So these things need to be thought about very carefully, and a long-term plan with regular intervention should be there. It is not something that will happen overnight, but a series of continuous intervention needs to be done so that we reach over there. And there is utmost potential. So like if I look at some data, so the diagnostic market, if I look at Africa, it is somewhere around 1.78 billion. But this is what the data says. But if you look at when we start actually consuming it, this will become very incremental, So these are some of the stats which I would say that, and they should be tech transfer. So once we identify that this is also between India and Nigeria, we can do tech transfer also. Wherein, specific issues need specific interventions, so specific technology can be brought over, and also there can be industry, academia in Nigeria also, so that focus, solutions can be deployed. So these are some of the thoughts which I will like to share with my audience over here. Thank you.
Thank you, Jatin. I think very pertinent points that you shared, right from tech transfer to even how we have an opportunity for hard skills and soft skills, whether it is creating more doctors, HCPs, or even path labs. So I think there's a lot of convergence that we can look at. Let me quickly now come to Mr. Bakr. Vicky has been one of the anemometers that I've been really going up and and when it comes to international diplomacy and international relations, whether I hear Gurveena or whether I hear earlier Mr. Panda or anyone else talking about it, we feel that more cementing and more collaborations is how the way forward we would look at stakeholder management. Your points on how, or your views on how basically we can actually forge more policy inroads into healthcare when we look at India, Africa, or when we look at the entire India, Nigeria, or for instance, we're largely talking about health diplomacy and then it's in the South-South arena. So your views on this?
Thanks, Rajiv. I think many of these institutional reforms that are required to have a collaboration between tourism, India and Africa, many of the points are already being addressed by my fellow colleagues.
We still have
but yeah,
policy.
On a policy level, I must mention here that there is a larger need of involvement of government to government interaction and MOUs. We have been promoting and recommending it to government through various forums that there needs to be a formal engagement in terms of agreements between countries in Africa and India, in terms of medical value travel, in terms of providing skilled manpower through Mode 3 and Mode 4. Also, there is one interesting reform which has just came into existence during G20 was the introduction of digital platform for HEAL in India. So this essentially is a platform wherein we give opportunity to healthcare providers globally to come and interact with Indian healthcare, be it from the services point or from having an institutional engagement. As you are aware, Rajiv and my all colleagues here in this learning panel would agree to me on this, that we already have an engagement with Africa and it has been predominantly there from decades. But there has been one-way traffic in a way. They have been coming here, getting themselves treated, and like from Nigeria just mentioned that we have been healthcare provider for them. But in terms of giving a capacity building back to their countries is something that we must look at. And it is not only a job of a government, but also the companies, the organizations, the hospitals, industry at large, to go and invest back in Africa, help them to upgrade their primary healthcare, help them to upgrade their tertiary healthcare. I know many of the hospitals, including Apollo and Primus, they already have their healthcare centers in Africa and Nigeria. But now it's time to go there in capacity as India as a brand and just try to make sure that they are also at a level play. And then we've been doing medical value travel. We already witnessed more than 4,000 Nigerians coming to India to get themselves treated. But it is just the tip of the iceberg. I think there's a lot that we can offer. And as an institutional engagement, not only with the Ministry of Health, but Ministry of Ayush as well. Because Ayush is something which we are not putting our emphasis on. India has a unique offering of providing holistic healthcare. I think if Ayush can also be, collaborated, and also the organizations and the institutions who are already offering services in Ayush, they can explore Africa. I think there's a lot of collaboration that can happen. I think with this, only one thing which I would like to reiterate, that government's vision is heal in India and heal by India. I think these are two principles that we should focus on, and I think we'll be able to become a global healthcare provider and also a big brother for Africa.
Thanks a lot, thanks a lot. I think you really became HEAL-Thy Samvad brand ambassador when you talked about heal. But yes, that's an important aspect when we really talk about it. We come to almost the end. I'm sorry we can't take another question or so, but yes, if there is a point, sir, yeah, please.
Couple of quick points, not much. I will take. 3-4 takeaways probably which we can talk. One is talked about like enhancing building capacity. India is very well known in Nigeria for this skills, and we have a lot of good teachers today. Why? And if you look at the number of pathologists, quality of biopsies happening in Nigeria, not more than 1.5 lakh biopsies in a year, which is required for cancer diagnosis. So India is 64 lakhs. That means the kind of exposure our teachers have. Digital platforms are available. Scanners can be sent, both sides scanners are there, upload, make a virtual teaching college can be done from here. We have a great pool of teachers today, and I think various medical colleges, we have short of faculty in Nigeria, we can fulfill the demand right away today. That simply exists today. I think that's taken from that way. Number 2 is something like this time of, you can say from AI and data. Why can't we make it's currently the population centric. You identify the population hotspots. You probably have, part A of the country, you have more hypertension, part 2, food diabetes. You plan your budgets accordingly, and probably you can treat the majority of disease and take care of health in a better way. And, lastly, very importantly, something like infectious disease. Currently, I just thought came to mind when you're talking about here. Like, why can't? Many of the infectious diseases are coming from neighboring countries. When we run a national program in India to control infectious disease, why can't we be partner? That means the infection may control the source of origin. That our national programs be like from there. We do anything in our house, inside house pollution free, outside raw pollution. I think that's something the area, if we can work around together, that will be probably very, very important. And last but not the least is always, I think it's you can say holistic care, inner health, not about mental health, but inner health. That's very, very important part today, because not many people have a mental stress, but I think if you know your inner health, self-worth, self-awareness, probably you can produce social excellence, and because all this pain, suffering, disease can actually feel depressing mood. I think that is India is known for holistic care, all kind of approach, online, digital, all should be adopted, and we probably can take a lead out there and work out. That's what
Thank you very much, sir. So I guess this gives me a cue that if we have an expert on the panel, then the moderator needs not to conclude everything. We've already done that. But thank you, everyone. There is, I think, time for a minute or so for questions, if anyone has any. Yes, sir.
I request Mr. Manish Rustogi to hand over the memento to Dr. Ravi Gaur. I request Mr. Dalip Manhas to come forward and present the memento to Dr. Rajiv Shipper.
Thank you very much.
Mr. Jatin Mahajan. Manish to present the memento to Mr. Atantra Daspata. Can I please request the memento to Mr. Ishan Pandita? may I request Devesh Kumar Mishra? I request all the delegates to form a group for.
And the product is about that. So we are making biosafety cabinets, laminar flow, which is being primarily used in diagnosis field, cancer therapy, IVF, and there are lots of areas where we can use this issue. Now I'm inviting Mr. Prasad, my partner, to represent our company and STPC.
Good evening, everyone. I would like to know how many of you know what a biosafety cabinet is?
I think everyone in the office.
No, I just want my 3-year-old kid thinks it's a kitchen cupboard.
No, it's a very important thing for us.
Yeah, it is a very
in labs, it's the most important thing to validate it.
We at AirBio getting with cutting edge technology and adding on new technology, we have developed this biosafety cabinet where it is 50% cheaper than the imported one. All these laboratories in India, they import these biosafety cabinets and it has been installed in India. But what we wanted to do is we want this to be done here in India and we give it in a very economical rate talking about the biosafety cabinets, we have around two models. There is one is A2 and one is class 2B. And I'm just this was one of the main important equipment which was used in COVID sample processing. Without this equipment, I don't think COVID screening or sampling would have been easier. And this is our biosafety cabinet. You can see with this, and I would like to explain more USPs of this equipment. Our equipment has a real-time data management which can be integrated with the lab information management system. And the next, we are using very low airflow sensors imported from USA to maintain the self-compensating airflow of the biosafety cabinet. And we are using very Dexter ECM so that we can save energy on this. In the laboratory, it runs for around 10 to 12 hours continuously, and energy matters, so we can save 70% of energy with these ECM blowers. And our designs meet international standards like NSF 49 and 12469 and the Electrical Safety of India 61010. And this is one of our USP. We have a very good angle of front design where it can contain the containment. And we are using SS stainless steel 316 so that it's a one-piece stainless steel so that it is very easy to clean and sanitize it. And this is our main USP where we use double wall construction. Normally people use single wall construction, we use double wall construction so that it can contain the air even if there is a power cut off or something like that. And ergonomic design, this is one of our USP with 10 degree sash fill so that person sitting and working on the biosafety cabinet can easily do the sash up and down. And these are few technical specifications. These are according to the standards of NSF 49. We have designed and we have achieved this.
So where are you getting? I mean, from you? Are you getting it from US, your airflow system?
So we are manufacturing everything here. We are assembling few parts here in our factory in Saibabad. Saibabad industrial area.
So what's the class you are achieving here?
Class and cleanliness, class and according to ISO 146. We are done, so we want to speak.
Give me your introduction.
Oh.
Yeah.
My name is Bakr Musa, and I'm the president of Nigerian Student Association, which is Nigerian Student Association in India, basically. And I am a student. I hold a Master's of Public Health, and presently I'm enrolled in a PhD in Public Health also.
सर आज इस संवाद कार्यक्रम में आए हैं, कैसा लगा आपको?
What is the message about this event?
This event is basically about the health diplomacy and the collaboration between the global South countries, which has been enormous in terms of bringing expertise and experts to discuss about how technology and then expertise can be shared between countries of similar characteristics.
मिश्रा, मैं करीब 20 साल से नाइजीरिया में हूँ, लागोस में प्लेस्ड हूँ, और अभी नाइजीरियन इंडियन रिलेशन के लिए हम लोग बहुत सारा काम कर रहे हैं। गवर्नमेंट को कैसे इंगेज करें, गवर्नमेंट टू गवर्नमेंट, गवर्नमेंट टू प्राइवेट और प्राइवेट टू प्राइवेट, इसके लिए सारा काम कर रहे हैं हम लोग।
तो आज जो ये इवेंट ऑर्गेनाइज किया गया है, इसके बारे में कुछ हमें डिटेल दीजिए सर, क्या पर्पस है इस इवेंट पर?
इस इवेंट का पर्पस है कि जहां सारे स्टेक होल्डर्स जो हैं हेल्थ सेक्टर के, वो एक साथ आएँ और हम देखें कि कैसे हम अपने जो अफ्रीकन भाई हैं हमारे, हम उनके साथ काम करें कोलैबोरेट करके, उनको कहाँ सपोर्ट की ज़रूरत है उसको हम सपोर्ट करें। जैसे कि हमारा जो विज़न है 1 वर्ल्ड 1 फ्यूचर, वैसे ही 1 हेल्थ भी है, इसको भी शामिल किया जाए उसमें। और बहुत सारा काम है अफ्रीकन कंट्रीज़ में जो कि इंडिया कर सकता है, और इंडिया को उनके ऊपर बहुत ट्रस्ट है कि जैसे अफ्रीका को कुछ लगेगा तो भारत एक बड़े भाई की तरह हरदम उसके साथ खड़ा रहेगा। और हेल्थ एक बड़ा सेक्टर है, बड़ा कंसर्न है अफ्रीका का, कि जिसमें इंडिया का जो अनुभव है, खासकर इतने मास लेवल का जो पॉपुलेशन का इतना बड़ा पॉपुलेशन है, उसको कैसे इंडिया एकोमोडेट करता है इन स्पाइट ऑफ ऑल चैलेंजेस। वैसे अफ्रीका का भी बहुत सारी कंट्रीज़ है, छोटी कंट्रीज़ है, लेकिन डेंस पॉपुलेशन है, जैसे नाइजीरिया हाईली डेंस पॉपुलेशन है, करीब 23 करोड़ लोग हैं वहाँ। तो वो हरदम भारत को देखते रहते हैं कि कैसे भारत हमारी मदद कर सकता है। तो इसके लिए आज का ये मीटिंग ऑर्गेनाइज किया गया था कि ये सारे लोग कैसे एक टेबल पे आए और हम नाइजीरिया में सारे गवर्नमेंट से, प्राइवेट सेक्टर से चैनलाइज करके और इस सेक्टर में जो भी हो सकता है एक दूसरे के साथ कोलैबोरेशन, इसको किया जाए और सक्सेसफुली नाइजीरिया को भी एक बेटर हेल्थ एनवायरनमेंट मिले।
तो सर क्या मैसेज देना चाहेंगे भारतवासियों को जो लोग आगे बढ़ के इस काम में सहयोग कर सकें, उनके लिए क्या मैसेज?
भारत के लिए देखिए, जब आप एक बार विदेश जाते हैं अपने देश से, तो भारत का जो एक सबसे बड़ा विचार है वसुधैव कुटुंबकम, कि पूरी दुनिया अपना परिवार है, ये बहुत बड़ा संदेश है। और खासकर G20 में जिस तरह से हमारी सरकार और भारत के लोगों ने किया कि बताया कि नहीं, जो पीछे हैं, जो पिछड़े हैं, देश भी बहुत सारे पिछड़े, और उनको एक ऐसे भाई की ज़रूरत है, और भारत को वो रोल निभाने का समय आ गया है, और उसको खड़ा होकर बोलना चाहिए कि हाँ, अगर तुम सचमुच वहाँ भी पिछड़े, दलित और वंचित हो तो आओ, हम तुम्हारे साथ हैं। और इसके लिए अफ्रीका बहुत अगर मैं मतलब शुद्ध हिंदी इतना तो नहीं बोल सकता, लेकिन क्या बोले कि भारत की तरफ देखता रहता है, अफ्रीका ताकता रहता है कि नहीं, कोई आएगा और भारत सचमुच उनके लिए एक बड़े भाई का रोल जो है वो निभा सकता है। थैंक यू।